Can I just give him a quick bio?
Sure.
So Dr. Steph came to me a few months ago, 5 months, I don't know how many, a while ago. And she's been a vet for a long time, but she's worked for a corporate veterinary hospital and she was chief of staff. So when you're chief of staff of any veterinary hospital, it means you're really smart. But she was, so in her prior life before she became a veterinarian, this is what I love about her, she has an MBA, she has a doctorate, and she was a journalist for the Boston Globe, which because my daughter's in Boston, it makes me love and adore her even more. And then before Dr. Steph takes it over, I want to say, Cindy Dowling, raise your hand. And Deb, raise your hand. These are my two friends who have dog diving dogs. They also have a dog snack business, treat business. And they are going to be outside afterwards, handing out treats and telling you about their business. So I hope you'll give them 10 seconds when you get done. Okay, Dr. Steph, where's my wine? Take it.
Hello, everyone. Yeah, let's give Dr. Pam a hand. She is our fearless leader. Thanks, Dr. Pam. We're really excited about all the changes we have coming. In particular, we want to highlight our new hospice service and talk a little bit about senior pet issues surrounding that. The talk today is called Old Dog New Tricks because we do have some new things that we can offer and be a little bit more comprehensive in our care plans for senior pets. So as Dr. Pam was saying, and I'll reiterate some of the things she said, I just want to introduce myself because for a lot of people who might not have met me yet, you don't know anything about me. So my name is Steph Sheen. I am an associate veterinarian here with these lovely ladies at Animal Care Center. So that's our team of smart, awesome women, and I am very happy to be part of it. I'm from Texas originally, and like she said, yeah, whoop, whoop, gig 'em. I worked at the Boston Globe when I went to college, and I also played rugby in college as a little aside. I got my MBA when I was at Texas A&M, and that's where I got my veterinary degree. So I am an Aggie. But I wanted to talk to you a little bit about senior pets. This is my old senior. This is Riley, and he's being annoyed by my little dachshunds, which is pretty typical. He's very long-suffering, as you can tell by his eyes. But I wanted to talk to you a little bit, because the question I got, even when I was walking around talking to everybody, is what exactly is a senior pet? How do you classify that? So generally, we say about 7 years of age. Sooner for giant breed dogs, so your Great Danes, your St. Bernards, they're going to start to get their seniors, maybe even around 5 or 6 years of age. For Golden Retrievers, as we talked about, probably 7, 8 is going to be when we get to senior, or 10, but she's not old, she's just senior. And then this is from the AVMA, and they kind of give you a rundown of cat years and dog years and a range of kind of what that's equivalent to in people years. So when we get to about 7, 8 years of age is a good time to check in with your veterinarian and see if there's anything that could potentially help your senior pet with some of those issues as they age and their systems start to break down, and we'll talk a lot about the common problems that we see with senior pets. Want to talk to you a little bit about kind of that slowing down, so that old age stage where we start to see, our pets get less active, and I think a lot of people think of that as just old age, and there are some signs that potentially that may be pain-related. Arthritis can be simmering under the surface, and if your dog is particularly stoic, you might not notice those things, so we're going to talk about some signs to watch for. But these days we have options for our senior pets. In the past, we had kind of 2 options when a pet was diagnosed with a life-limiting disease. So something like cancer, but even diabetes or kidney disease. We kind of had the option to do everything, to be really aggressive with our treatment, to go all out and see if we could fix it if we can. And the other option was to do nothing, which sometimes resulted in premature euthanasia. So we would get a cancer diagnosis, and even though we felt like the pet still kind of wanted to be around, we thought, well, it's just going to get worse from here. Let's just euthanize now. So, and those are acceptable options still, but we have a third option to offer, which is our hospice service. It kind of bridges that gap between do everything and do nothing. And we'll talk more about what options are available and what that looks like, but that's kind of the big topic here. In talking about common senior dog health problems, the majority of these are going to be your normal body systems breaking down. So cancer is really common as our pets are living longer and longer. Heart disease, kidney disease, liver disease, diabetes, all of these things are things that we, if we get on top of them early, can manage as we go along. Most of these, some of them, almost all of them, can't necessarily be cured. And I think that changes the way we approach it these days, in that we manage these conditions and are able to keep pets really comfortable for a long period of time, although we can't necessarily cure them of that. So I want to talk about some common health issues. And if you guys have older pets, and I talked to some of you before the presentation, and I know we've got a range of ages, but I wanted to talk to you a little bit about the most common ones and what things we can do for senior pets these days. So I would say the most common disease that I see in older pets is going to be arthritis. How many of you guys have pets with arthritis at home? I do, for sure. So more than half of us. And some of you may have pets with arthritis that you don't know about. And so we'll talk a little bit about that. But it's the most common disease affecting older dogs, and it's a combination of two things that creates arthritis. There's usually some instability in a joint. So for instance, these hips here, the ones on top you can see are nice and smooth. So those are good hips, sitting right in that ball and socket joint, nice and tight. And the ones you see below it are ones that have some severe arthritis. So you can see how the tops of those joints get really flat, and they're kind of moving around in there. You can see where they're not seated nice and tight in that cup anymore. And so as it moves back and forth, the body hates that. So it tries to create some bone to help stabilize that joint. And that's what creates this arthritis. So all of these kind of prickly bits here, rather than that nice smooth surface, are going to be the ones that grind as they go through, and that's what causes the pain. So we've got some inflammation going on, so lots of swelling and pain associated with that, as well as the pain, and it kind of acts in a circular way where we get inflammation, which causes more breakdown of that cartilage, which causes more arthritis, and so on. So what we want to do with our treatment plan is kind of attack that in a few different ways. So we'll use a multimodal treatment plan, which means that we don't just rely on one thing. We use a lot of different things to try to provide that comprehensive care for it. So one of the things we can do is supplements, and one big thing we use is something called Adequan, which is an injection that you give, we can teach you to give at home, and it's probably the thing that I see the biggest improvement with. Would you agree, Dr. Kara?
Absolutely. So Adequan's a really nice option for that's not a drug that has major side effects. And it helps keep the body strong instead of just preventing inflammation. So you're actually doing some prevention with it too. It's amazing.
Absolutely.
I think I've heard Dr. Pam say many a time, it's one of the few things that she would refuse to practice without. It's the only drug I would refuse to practice.
Yeah.
I can find alternative antibiotics, alternative non-steroidals, but if Adequan were available, and by the way, when it comes out for humans, get it.
Yeah.
Or invest in it.
It's awesome. It's kind of like an oil change for the joint. So it's something that we give underneath the surface of the skin. Like we said, we can teach you to do it at home. And after the initial loading period of a month, you just kind of booster it as we go. And it provides that kind of nourishing particles for the cartilage that keeps it nice and healthy and prevents that breakdown that we talked about. Anything
And I
else?
think a lot of, if you've ever seen another veterinary hospital, they give up on it really fast because most people see a gradual improvement with the first 8 injections. When you notice the biggest improvement is typically that booster shot. And it's amazing. Like my senior citizen, I think if he starts to get prickly and really sore, instead of increasing his drugs, I booster his Adequan 2 days later, he's more limber and more comfortable, which is a huge deal. I'm not just adding medication.
Absolutely. There was a question?
I did. If you fall behind on the once-a-month booster, should you just pick back up on that?
Yep, we just pick back up on the booster. Once you've done the initial series, then you just booster it thereafter.
I started with every 6 months I was boostering.
Yeah.
And then when I noticed that it was making a huge difference, I made them closer together because I didn't want to walk somewhere else. And closer together and closer together. Now it's going to every 3 or 4 weeks,
Yeah.
which is totally off-label, but some of our police dogs are even doing them every 2. The most frequent I've done it was every 3 days, and a 16-year-old dog named Custer. Well, a 16-year-old golden retriever named Custer.
Yeah.
Is there a time frame where you would need to, like, say you go longer than 8 to 10 months, would you want to redo the preliminary shots and then go back to the boosters?
After 6 months, then go back to the booster series. And the booster series isn't necessarily as long. We kind of depends on response.
Yeah. So that's a great option we have, and one with very few side effects and the potential for a big improvement. So those are the things that we always want to try first. And the sooner we can get that on board, the better the response. So we want to try to protect that cartilage because once it's gone, it's gone. It doesn't mean that we can't see improvement even in advanced arthritis, but it helps really those early signs where we start to see him having a little bit of difficulty getting up. Glucosamine and fish oil are ones we talk about a lot. I think we utilize them, especially fish oil, for reducing inflammation. And I think that there is evidence that those help. I think they're, again, one of those preventive things rather than treatment things. So they're something we can get on board and try to help slow down the process, but not something that's going to treat what's already there. So Royal Canin has a mobility diet. Their large breed mobility is the one I like best. And then Hills has a JD diet. Both of these would be available from us and we can ship directly to your house if that's something that you're interested in trying. But they're great.
Science Diet also has a product that's combined for allergy dogs and joint dogs. So it helps with their skin, it helps with their allergies, helps digestion, and GI issues.
And they've got some combination products as well. So one of the things we're going to talk about is optimizing our weight. So like Dr. Pam said, adding that extra force of any extra pounds that your pet may be carrying around puts a lot more pressure on their joints than they usually would have. So the best thing we can do, in addition to some of these treatments to help slow down the process of arthritis, is to get to that healthy weight. So they've got combination products that do the joint support as well as help with weight loss. So mobility, or Hills has the metabolic and JD combination. So that would be a great option for some of you that have dogs with a few extra pounds. And then medications, and that would be something where we could kind of talk with you about what might be best for your pet. But the foundation of our medication regimens are going to be an anti-inflammatory medication, something like Rimadyl or Daramax or Meloxicam. So there are a few different options. That's going to help with the pain and the inflammation, which is why it makes such a big difference for joint pain, for arthritis. On top of that, we may add some extra pain medications that work in conjunction with that because there is a top amount of anti-inflammatories we can safely give. And that's why we want to do combinations with other types of pain medications to make sure we get a well-rounded pain control treatment plan on board. Then we have complementary therapies, and I was just going to have, Dr. Verona's not here, but I was just going to talk a little bit about acupuncture. And I think people kind of span, either they're really all about it or really against it. But I think we have good evidence, and to me that's what's most important. I definitely would say I'm more of a Western practitioner, having that good evidence that this helps. It stimulates nerves, it helps with regeneration and healing, it can help with things like incontinence, stomach issues. And Dr. Verona is certified acupuncturist. She's gone through additional training to become certified, and she does acupuncture appointments probably every day, right, Sam? And do you have any particular things you'd like to add about that? Maybe pets you've seen? Please.
Go ahead, Sam. I was going to add something too.
No, acupuncture, I'm also one of those very Western medicine. I thought it was hokey pokey. I love Dr. Verona dearly. So at first I really thought it was crazy, but the coolest thing about dogs is they don't lie. So if a dog feels better, they feel better. So I personally had a dog who wasn't using a hind limb and scheduled for his amputation. Dr. Verona said, please let me do this, so I did it. And I kid you not, the next morning that dog was walking on all four legs. And we have lots of dogs who get their acupuncture, and the owners call us the next morning and say, this is the first time my dog slept through the night in 2 weeks.
Yeah.
And my own dog, I have a senior pet and she's suffered arthritis for a long, long time, and we've been doing the Adequan thing. And personally, I found between Adequan and acupuncture, I would alternate them, and I would do Adequan booster, and then 2 weeks later, some acupuncture, 2 weeks later, Adequan. I kept her completely off of non-steroidal anti-inflammatories and pain medication for years with just Adequan and acupuncture.
Awesome.
And now she's 13, she gets some Rimadyl and things like that mixed in, but I continue to have amazing results with acupuncture for her.
Thank you.
Before Dr. Alley showed up.
The other thing we have available for helping to treat arthritis, Dr. Alley, who does chiropractic. So Dr. Alley, I just wanted to have you talk for just a moment about what kinds of things chiropractic adjustments are good for.
Okay, so probably about, I would say over half of my patients are typically...
Do you want to come up here, Dr. Alley, and that way people at home can see you?
So probably at least half of my patients are senior dogs, and we just find that doing chiropractic adjustments on these dogs with arthritis and with these joints that are starting to get stiff and starting to get uncomfortable. Like Dr. Pam said, one of the causes of arthritis is abnormal forces on a joint. And if a joint is not aligned properly within the body, which is what basically the definition of a chiropractic subluxation is, it can be very subtle, but just a slight little rotation to a joint or just a slight little offset to it can create abnormal forces on that joint. And so doing chiropractic on younger dogs can be a preventative measure, and it's hard to say for sure. When you're doing things preventatively, it's hard to know whether it's actually effective or not. But people who start their dogs young tend to like the results that they get as they get older. They just tend to stay very healthy and mobile and active. But that's not to say that I don't have dogs that the very first time they see me, they might be 15, 16 years old and really having a hard time getting around because of the severity of their arthritis. But sometimes those little adjustments can really provide them a lot of relief and a lot of comfort when they've been extremely locked up in a certain area of their back or a certain area of their pelvis or their neck. And by just providing them that little bit of extra movement and motion and getting those muscles to release around it, it just feels that much better for them. So it's a great solution as well, and works very well also along with the acupuncture and the rehab therapy that we have. A lot of people will bring their dogs in and do all of them, or do a couple of them together. We'll do chiro and acupuncture at the same time, or they'll alternate between the two, kind of like you did with Sierra and the acupuncture and the Adequan. Yes, Heather?
Well, we have, you know Mika, our 7-year-old, and she is a rescue dog and she's extremely anxious. I bring her to Allie for adjustments because it calms her down. She's less anxious, she's less wild.
Wow.
And the first time I brought her, my family all mocked me. Every last one. They mocked and made fun of me, but we got her home and she was calmer.
Yeah. And you probably heard people say, well, once you start going to a chiropractor, you have to keep going, right? Well, it's not that you have to keep going. It's that a lot of people want to keep going because it feels good. It does release. It releases natural endorphins and your body's natural painkillers get released when you do those things. Not only chiropractic, but acupuncture and massage and things like that. Release those so that you're boosting your body's own capability of healing itself versus having to just pump in more, medications or chemicals to achieve that. So.
Thanks, Dr. Alley.
You're welcome.
My personal story is Eleanor, who the year before she died had chiropractic probably once a week and acupuncture about every other week. And Dr. Alley made a huge improvement. Eleanor was an old standard poodle, and Dr. Alley did wonders for her quality of life, truly, the whole last year. So if you haven't tried it, don't be a skeptic, give it a try.
Yeah.
And give it a couple sessions. Yeah. Because
Yeah.
sometimes it takes a couple. Although chiropractic seems so fast. Like it's instant. Like they seem better immediately.
And Dr. Alley alluded to it, but one last thing that was on my last slide was rehabilitation. So it's not just for post-operative rehab, but you can actually utilize those same rehab services to help gain strength, especially some of those people I talked to before the presentation that have dogs that are losing a lot of their muscle mass. We utilize things like water treadmill, which takes off the pressure of those joints and allows them to work with some resistance in a safe way that's non-painful for them to help gain some strength. Dr. Pam, do you have anything else to add about rehab?
No, just rehab is a really nice way to make your dogs comfortable. I mean, we've done Husker, the old golden that I did Adequan every 3 days, would come in to rehab twice a week and just sit in the water. And we wouldn't even, by the end of his life, we wouldn't even walk him in the treadmill. We would just soak him in the treadmill, let him float, take the weight off of his joints, and the hydrostatic pressure of water on his joints and his muscles made him feel really, really good. We actually rehabbed a cat too. I'm looking at Al thinking, cat man.
Yeah.
We rehab cats too.
Awesome.
But mostly laser massage and
Yeah.
water.
Well, to talk a little bit about what signs you might see if you don't know if your pet has arthritis or not, or just signs of pain in general, my question was, how many of you, by show of hands, think that dogs hide their pain? Yeah. And I think if they do it, they don't do it consciously, because how many of us have had a dog step on a sticker, burr, and hold their hand up, right? They're soliciting help from us. This is painful, I need help. And I think that with some of these chronic conditions, they kind of adapt and get used to it, and so it might not be as evident to us, but there are ways that they tell us that maybe we don't understand. So because they can't speak to us, a lot of the things that they're going to do are physical. And so signs of pain would include just decreased activity, especially things like going up or down stairs, not wanting to do, go chase the ball where they used to love that, less interested in those activities that they liked. Vocalizing they can do sometimes, but I find that that's actually a less common sign of pain in our dogs until it gets very severe. I find that they don't typically vocalize. This is a big one that I see, is a behavior change. So your older dog, you go to pet them a certain place and they might turn around and snap at you, where you think, oh my gosh, my dog has never done that. That might just be a sign that they're saying that area is really painful. You might see dogs, that have kids playing with them that start to get aggressive because they may be having pressure placed on areas that are uncomfortable for them. So behavior change and aggression is something we typically do see with pain-associated conditions. So if you find that your pet is having a behavior change, it's good to get them checked out and see if there is an area of pain before kind of going down that behavior route. So facial expressions, they can start to get a little more squinty-eyed. Their whiskers can kind of start to point forward in those late stages of really being painful. You'll notice them kind of just be hunched up. We had a dog today that, just feeling along the back, you saw them really arch up and their skin kind of crawled when we got to a certain spot on that back. And that's a really common sign too. So as you're kind of rubbing over them, if you see them really wince a little bit, they definitely do that to show signs of pain.
How many of us have seen a dog that instead of just gently laying down, kind of flops?
Mm-hmm.
Those are usually dogs that hurt. There's a reason they're not gliding comfortably to the floor. That's usually one of the first signs we see.
Yeah.
Most of this stuff isn't dramatic. It can be as simple as they changed how they poop. All of a sudden their feet are closer together because they're shifting all their weight on their front legs instead of putting it on their back legs. So just noticing subtle things in your dog and questioning, does he always poop with his feet crossy? It's a weird thing to watch, but it's a really good indicator, and it's a really early one, which is nice.
Yeah. I think that's huge. A lot of people tell me, they're really having a hard time after laying down, getting moving. They're kind of walking on eggshells for a little bit before they warm out of it. That's a classic sign of arthritis because they kind of have to warm up those joints just like we do in the cold weather, kind of get those moving before they feel comfortable. So thanks for that, Dr. Kara. Another big thing that we see with advanced age within our senior pets is cognitive dysfunction, or kind of doggy dementia. Senility is definitely something that we're seeing more and more as our pets live longer. And it's something that I think not a lot of people know a lot about. The big signs that we see are these signs right here. The one I notice most often is going to be night waking. So they kind of switch their schedules where they're kind of walking around at nighttime, pacing, panting. They start to get anxious about things. They forget about potty training. They start to regress and have accidents in the house. They'll get caught behind tables and not know how to get out, or start whining for no reason. So those are some of the main signs we see, and there are things that we can do for that. There are anti-anxiety medications. The biggest thing that's really easy to do is start feeding them in food puzzles. The sooner we can start working their mind and keeping it sharp, just the same as people, they recommend doing puzzles to keep their mind moving and keep those problem-solving abilities. So some of the things that I read about that were mentioned is having them walk on different types of surfaces. So taking them out, going through sand, or having bubble wrap around, or something that kind of engages their mind of that's not usual. And then food puzzles are great, and environmental enrichment. So putting a birdhouse outside, or have them access to a window so they can look outside and see things. So not just having them at home with low stimulation where they're kind of just sleeping all day, but giving them opportunities to learn and experience things. Taking them for a walk several times a day for short periods of time so they get novel smells, novel sights, so they're not getting just really bored, because that does happen for some of our older pets, is boredom, and that can lead to anxiety. Yeah.
Fish tanks for kitties.
Yes, and fish tanks for kitties is great. And birdhouses for kitties are great. Yeah.
And my plug is going to be for this room right here. This is our senior lounge at the Utah Dog Park. And I have my dog, my 13-year-old, comes to daycare here every single day, 5 days a week, because I call this her, what do I call it? Doggy, what is the word? Memory care. Memory care for dogs.
Ironic.
Right here though, it's safe for them. There's nothing that she's gonna get into and hurt herself. There's an attendant that comes in here and plays with her and talks to her. She can go outside, inside, watch these dogs playing, lay on the couch, watch the TV. It's enough stimulation
Yeah.
for her to not get into any trouble, and it's completely safe. She's not gonna eat something and get obstructed or hurt herself, which is what she tries to do when she's left home alone. So.
Yeah, absolutely. So senior daycare is definitely one. They've got some diets now that help a lot with cognitive function, with brain function. A biggest one is Bright Minds, and Sam's dog is on Bright Minds, and she says she's seen a significant improvement.
My dog is on the Hills version, BD, their brain diet.
And Purina is Bright Minds.
Yeah.
It's terrific.
Absolutely. And then there are some medications and supplements we can try to help with that as well. So again, early intervention is going to be key there, but we still can get on top of it and help with some, especially the anxiety portion. I think that that's what affects quality of life most of all with this condition. Yeah. I'm sorry, was it Sammy? Yeah, I think Sammy is great. It definitely helps with liver disease in particular, with protecting the liver and kind of helping it with its functions. Some of the ones we look at are, I think it's L-theanine, and there's a few different types of amino acids that are helpful. Can you think of
What is it? Which is why decent food matters.
Right.
I swear by color.
Yeah, and there are some dog supplement companies making kind of a combination of those things for older pets. And then we see a lot of vision and hearing loss, and I know, right? So this is something that we can utilize as a tool we can utilize for dogs that are blind, that have become blind. So this in particular is made for blind dogs, and it's a little harness that attaches and has kind of a cone around. So if they do go, traipsing around and bump into something, they'll bump the halo rather than bumping their nose. And so it's kind of, in novel situations, nice to have. There can be a lot of different causes of vision loss, cataracts being a big one, just age-related cataract formation or cataract formation secondary to something like diabetes is very common. So in those cases, there are surgical options available. Most people choose not to do that, and that's okay. Yeah, so get pet insurance now, so you can do it. But in the event that you can't, we can manage that, and there are some things we can do with the environment, like utilizing those harnesses. They do tend to memorize your house, so you'll find that you don't even know that they have any vision loss until you take them somewhere new, and they bump around or can't find their way. So for some of these dogs, just keeping everything the same, they'll be able to get around fairly easily in your home because they'll kind of memorize where everything is. And then hearing loss, the cause of that is just age-related change to those bits in our ear. So they get a little more stiff and less movable, and we start to see some hearing loss. So a lot of people say, I really have to walk up to them and kind of, clap to get them to recognize where they used to be barking. And I'm seeing that with my own dog, with my golden retriever. So a couple interventions that you can do that I thought were really interesting is teach your dog hand signals. So rather than teaching them oral, verbal signals, so saying, sit and stay, actually have them learn, sit and stay and those kinds of things, because you can still communicate with them utilizing those hand signs, which actually they respond to better than verbal signs anyway. So starting that now, so that when it happens, they know them and you don't have to teach them to them that way. They also have vibration collars that just provide a little, it's not a shock, but just a little buzz to get their attention, so they can still, you can still rouse them, and they can be interactive that way, and you can utilize that.
And I'll be selling those columns.
We'll get some construction paper and staples. I thought that was hilarious.
Yeah, just take them off.
Yeah. The last one I'm going to touch upon before we get into a little bit about hospice, and I am going to try to hurry as we go, is incontinence, because I think that this is the biggest quality of life issue for us, not necessarily for pets. They can cope with some of these things, but fecal and urinary incontinence are two big conditions that we see with our older pets. For fecal incontinence, it mostly is that little sphincter that holds everything in just gets a little bit weaker. The nerves aren't sending the signals as great as they used to, and it gets a little weak. So the big way to tell if we're having fecal incontinence versus just accidents in the house is watching when they poop, if they notice that they're pooping, or if it kind of just falls out. So if they actually posture like they normally do, squat and go, then that still means they have an idea that they are going. But if it kind of just falls out, that most often is associated with actual incontinence. So
Being aware of it, sometimes that can be one of the signs
Yeah.
of dementia as well.
yeah.
So if it's just falling out and they're not aware, it's typically not a sign of cognitive dysfunction. But if you
Yeah.
see them just dropping or like acting like they're going but in a weird place, that's a dementia
Yeah.
or urinary tract infection. So please have it checked.
Exactly. So for fecal incontinence, acupuncture can potentially help, or working with fiber in the diet to kind of increase the bulk of the stools. For urinary incontinence, it's definitely different. We want to make sure we rule out any medical causes for urinary incontinence before going down the road of treatment for that. And there are medications that can help with urinary incontinence. We want to make sure we don't have an infection present or stones in the bladder, or cancer or those kinds of things. So there are some tests that we can run that are fairly straightforward to do that can help us with that.
We can inject collagen in some cases. So
Yeah.
that actually tightens up that sphincter muscle.
Absolutely. There's some pretty cool therapies out there. So the interventions depend on the cause, on what's causing it. For actual incontinence, the thing you'll notice is they go when they're sleeping a lot of times. So they'll wake up to a big puddle around them. So again, not aware that it's happening, and that kind of sphincter thing is what we're dealing with there. For urinary incontinence in particular, also for fecal incontinence, but urinary incontinence, we want to make sure that we're utilizing good hygiene with these guys, utilizing pads that can kind of soak that up. A good way to go about doing this is to get like a baby bed. So a little baby mattress that is plastic on the outside, and then cover that with whatever bedding you like, maybe even put some absorbent pads underneath that. And that's an easy way to kind of clean it off really easy without having to go through a ton of dog beds and be doing wash all the time. So another question by show of hands: how many of you think that hospice means that we are not going to euthanize? That we're going to try to let them die naturally? Good, because you're exactly right. Hospice does not mean that euthanasia is not an option. It may not be our first choice in some cases. We may decide later that that's what we want to do, but hospice doesn't mean that we're not going to do anything, that we're going to let them pass away on their own. Our goals in hospice change from pursuing that cure to making the pet comfortable. So we say, I don't want to do tons of diagnostics. I don't want to, it's not going to change what I decide. I do want my pet to be comfortable. And I think that that's where we can really intervene and help. There are some environmental changes we can make and medication changes we can make to keep them comfortable. And it isn't just for the pet that was diagnosed with, end-stage cancer and is going to, and is going to die tomorrow. There are different levels of hospice care. So when we think about hospice care, we think about 3 different levels. The first being palliative care, and that's for things like arthritis, chronic diseases that need a little bit more help in management, that we can check in with you. So these guys, we're thinking they're going to live months to years, that we've got plenty of time. Example again, arthritis. We're going to have monthly check-ins on our side, so we're going to be calling you or visiting you monthly so that we can keep on top of things and make adjustments where we need them, and that we can see changes as we go along. We can be that third party for you to kind of see how things are different that you might not notice if you're living with that pet every day. Our next level is early hospice, and this is when we think that the pet may have weeks to months to live. So things would be an early cancer detection, or a dog that's really in decline that we think pain is getting bad and we need to kind of talk about how we're going to manage this going forward. And we're going to be checking in with you on an early hospice plan weekly. So we're going to be calling you weekly, we're going to be visiting you weekly. We're going to make sure that we stay on top of things. And that allows us to really act proactively in changing pain care plans, in modifying our hygiene routines, and we can work really closely with you in showing you how to do those things appropriately and making sure you have the right equipment to do it. Late hospice is going to be for those pets that do have a life-limiting diagnosis where we think it might be days to weeks that we have left. And we're going to be checking in with you daily in those cases. We're going to be making sure that we guide you through that process because there are a lot of changes that happen with you in that time, and accepting that that change has occurred with your pet and coming to terms with that. And one of the textbooks I was reading on hospice mentioned this statistic that longer enrollment time in hospice has been shown to correlate with improved quality of life and potentially extension of life, because we're catching onto those things early, making changes early, and really being on top of things as they progress. Is this going to be something where we have a steady decline? Is this going to be something where we're doing really well and then we're just not going to do well one day? So we can tell you what to expect with your pet's particular disease so that you can prepare yourself and know what's normal with that disease. That helps you to kind of say, I knew this was going to happen. It's not going to be out of nowhere. We're going to have a plan in place for when those things happen so that your pet doesn't have to have any distress during that time. You'll already have the medications to give them when that change occurs. And I wanted to address that concept of, is it time? And I think that, when we think about is it time, it's more helpful to think about that as we're never going to get that bullseye. We're never going to get, it's the exact time my pet would tell me that they want to go at this particular hour, at this particular minute of the day. The best I think we can hope for in our realistic expectation is that we get somewhere on the target, that we say, this range of time is the appropriate time, and any time we choose within that range where we feel like our pet is ready to go, that's the time where we're ready. And that can be really difficult to do. As many of you know, I was talking to some of you, I saw a lot of emotion, and I see Dr. Pam, a lot of emotion associated with that. It's a very, very hard decision. And that's what hospice is intended to do as well, is be with you through that decision and help you make it in some cases. When we think about what our animal would tell us if they could, I think we need to be open to that idea changing. They have different wants and needs as we go throughout the process, and so we need to be open to changing our plan. I know Sam was talking to me earlier about this concept of planning and what we would expect and want for our pets, and that it's kind of like giving birth, which I don't have any any experience with, but for those owners who have experienced that, you have this birth plan in place, and then things happen. And so you have to kind of, this is what I would want to happen for my pet. In particular, I would want them to pass away on their own. What's that? Yeah. And then throw it out the window because life happens, right? So I want to talk a little bit about quality of life. It's a very nebulous topic, so it kind of, it's hard to quantify and say exactly this is what quality of life is, good quality of life versus bad quality of life. I think the people I talk to about quality of life, the thing they focus most on is, I don't want my pet to suffer. And I think that is such a loaded word, suffering. I think it depends completely, it's a subjective experience on the pet's part, and so we can't ever really tell if they're suffering. What I like to use instead is the term distress. I want to get up and I want to run over there, but I can't. That's distressing. I want to get to my food bowl and I can't reach it. That's distressing. I need to pee and I can't get up to do that. That's distressing. So all of those things I think are part of our quality of life evaluation, but they're not even the most important part. I think the most important part is, does my pet still want to be with us? So some of these other positive things, adaptability. So things like incontinence, a limb loss, becoming blind or deaf. To us, that would seem like something we couldn't comprehend, we couldn't live with. But you'd be amazed, and I'm sure you all know, at how adaptable our pets are to those things. We had a little puppy that had a very bad fracture that we amputated his limb just a couple weeks ago, and he's running around like he has always been three-legged. You'd be really surprised. Yeah, he needs a home and he's really cute. So we want to focus on the pet's response to their circumstances and not even necessarily the circumstances themselves. So, you know, what are their sources of enjoyment? And we can adapt those things. So my golden retriever likes to chase a ball. When he's not able to chase the ball anymore, I can roll it to him. And he can catch it in his mouth and I can roll it to him again. So there are some things we can do to make sure that even though they might not be able to do it in the same way that they were doing it, that they still can do those things that they like to do. Their capacity to cope or adapt, their desire or will to live, you guys know them best, and that's why we're going to utilize you in our hospice plans of when you see that light go out of their eyes, when they just don't seem like they're enjoying life anymore, that's a good sign that it's time. So these are a couple things to think about, positive and negative feelings. We want to, you know, increase the amount of positive experiences and decrease these things on the negative side. So pain, hunger, full bladder, nausea, itchiness, social isolation is a big one. I think as our pets get older, they get less active, and we don't include them as much in family events, and, you know, because we think, oh, they're just, you know, or leave them in the quiet room where they're not going to be bothered. They want to be with you. They're pack animals. You're their pack. And so I think it's important to include senior pets where we can in regular family activities so they maintain that connection. So these are things that we can address with hospice. A lot of these issues are things that we have great medications for, that we can keep them really comfortable and safe from these feelings. So just kind of as a last bit about that, it's always going to be a difficult decision, and there's no one right answer. It's normal to be uncertain because it's a complex situation. There's so many variables, and you're making this really big choice for your pet who you love so much. There are a lot of right answers. There's not just one. We can always change course. So if we decide to pick a treatment and we want to try for your pet and we find that it doesn't work, we just stop doing it. We change to something else. We have lots of options. We have flexibility, and it's not failure. It's just a different way, because they work differently for each pet. We talked a little on your paper there about this scale, which is a nice kind of objective way to evaluate your pet's quality of life. So it looks at those different aspects of health and living, and kind of asks you to gauge them on a scale of 0 to 10, and then add up all those points, and it kind of gives you an idea of if they've got good or bad quality of life. So it has a little more explanation in the handout that I gave you. And the last thing would be recommending to keep a journal of your pet's good days and bad days, because I think it's easy when you're in the thick of things to kind of get to lose perspective. So it's good to be able to go back and say, yeah, we had a good run of good days. We're starting to see some bad days, and it's becoming more and more bad days than good days, and that can help you evaluate a little bit as well.
At our house, we have a list of 5. So 5 favorite things to do. And that goes for, so our kitty, she loves to hunt. She loves to hang out on the bed at night. She loves to play with her toys first thing in the morning. But she has her list of 5, and we put that list in the fire safe, and we say, you know, we'll revisit this if something goes wrong. And for our family, the right answer is when 3 of those are crossed off, it's more about us than them. And that was the right decision for our family. But it's a really nice way to put in perspective, oh, you know what, he played ball today. Kind of forgetting the 3 days before where, you know, they didn't want to get out of bed. So it's a really nice way to just kind of take that step back and have something documented when they're young. Don't wait until they're senior citizens to do it. And if the right answer is to put them on hospice care and keep them comfortable until they go naturally, that's your decision, and we respect that completely, and we will help you through it. But that's what the service is there for, to help you with those decisions that you're allowed to make. That's all we want to help with.
Yeah, absolutely. And they're kind of, you know, when we get to the end, when we get to that point where we want to make that choice, and even when we start talking about what your preferences are, we have the option between a hospice-assisted natural death, which is not the same as not doing anything and letting your pet pass away on its own, because that can be quite painful. The idea behind a hospice-assisted natural death is that we provide enough level of pain control that your pet can pass through on its own. And it can be a long process, and it can be a difficult process to watch. I think that these days more and more of natural deaths are happening in hospital environments assisted with that, and we kind of forget or haven't experienced, I know I haven't, what that looks like. So there are some things we can go through with you and talking you through what that's going to look like and what you can expect. Even if we choose that this is the way we want to do it, we can always have euthanasia as an option. So if it ever gets to the point where we feel like we're not controlling that pain well enough, we can choose to euthanize at that time. But this is an option. And then euthanasia. We can perform that in your home where your pet's most comfortable. We can perform that in a special place. So if there's a park your pet loves, or a very pretty place that you'd like your pet to pass away, we can make that happen. We can do it in the veterinary office if you find that you don't want to have those memories in your home. We'll make a safe space for you here so that we can do that with you in that environment. It utilizes both anesthetic and pain medications as well as euthanasia solution, so your pet is not conscious when the euthanasia solution is given. It typically is very peaceful and very smooth as much as we can make it. So I think it's a beautiful gift that we can give them to allow them to pass away that way. If you have any questions about that, I'd be happy to answer them. But again, it's always an option. So lastly, I just wanted to say that part of this hospice process is connecting with yourself and doing a self-reflection on, what you want for your pet, what you yourself can handle, because this isn't for sissies. Hospice care is a lot of work, and it's an emotional strain, but when you do it, it can provide a bond stronger than you ever would imagine possible with your pet, to be that person that gives them that care through the end of their life and supports them in that way. And we can help support you in providing that. And that's the intention behind our hospice service, is to be partnered with you in your pet's care and make it absolutely individualized for your particular pet. So I just wanted to end with Riley again, because he's my love. And just say that it's such a special thing that you guys allow us to be part of your lives and be part of your pets' lives, and that you trust us with them. We take that very seriously. We love to be involved with you guys in happy and sad times, and you're part of our family. So we are offering this service so that we can be there with you physically, spiritually, emotionally. It's going to be a lot on our end, but we want to do that for you. So what questions do you have? Thank you.
So it's 3 minutes till 8, and I'm pretty much a stickler for time. And so I want to just say a couple of really fast things about Dr. Steph and this new generation of vets. And then we'll open up to questions, and we'll mix and mingle, and we can turn off our FaceTime Live. When I was a baby vet, when I gave a diagnosis of osteosarcoma or hemangiosarcoma or some bad disease, I would say to the owner,
Baby helps.
baby help, that's my baby Petunia.
Baby stew.
I would say, we know your dog has a terminal disease. I want him to be out of pain, and I want you to pick a time that's best for you, because we know how this is going to end. And we would pick a time to let that dog or cat go. And it wasn't wrong. It was just that it was so painful to watch that sequence of from healthy, bouncy, happy, maybe limping, to gone. And what this new generation of vets has taught me, and Dr. Kara and Dr. Verona, is that there's a whole continuum between your dog has a terminal diagnosis, and honestly, I'm 53. Vets that are over about 40 go, okay, so it's time. Let's go. This is about you, not me. I mean, not your pet. This is about you. You're keeping your pet alive because it's about you. And that's really, it's very, very different now to be able to say, we've got people like Dr. Steph who are saying, hey, we've got a whole nother option here to make sure these pets are alive and happy as long as they can be alive and happy. And it's not about adding more time. It's about making sure that as long as they're happy and comfortable, we're not going to end it prematurely. And when Bridgie, my little golden baby, got cancer, I didn't euthanize her right away. I mean, I can honestly say with Bridgie, I waited too long. And I was in that gray zone where I was asking Dr. Kara and Dr. Verona, and I was like, what? She had lymphoma, and I treated her as long as I could, and she ended up having spread to her brain, and she died ultimately having seizures. And I felt terrible that I didn't manage her appropriately, and I would give anything to have had Dr. Steph and Samantha, and frankly Dr. Kara, helping me manage them better, managing Bridgie better towards the end, because it's just this miraculous thing to see these dogs be happy right up until the very, very, very end. And so I just kudos to you, Dr. Steph, because
And Dr. Kara.
well, and Dr. Kara, truly, and Samantha, because Samantha's spearheading this. And I mean, and if it weren't for you clients that are willing to listen to new vets come along and come up with better ideas, we wouldn't be able to do this. So thank you to all of you. And thanks, Dr. Steph, and little baby petunias for keeping me from crying.
Her name's not really Petunia.
Her name is Victoria. So Victoria Grace is my little petunia. Anyway, thanks, Dr. Steph. Can we just give her another round of applause? Thank you. For a really lovely job. Please.